Hey, Kathy, I'm thinking about having some work done.
Some work done. Did you hit 200,000 miles or something? Have you been keeping up with your oil changes?
No, seriously. Is there like a guy version of the mommy makeover?
Oh, plastic surgery. Yeah, you could use some work. Today we have the perfect guest for you. He's a board-certified plastic surgeon who's been working with patients for 3 decades, helping them regain their confidence and health.
Yeah, this is going to be a really good one. Watch until the very end because we're going to be talking about the history of plastic surgery, who needs it, who doesn't, and everything in between. This is The Pitch. What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. Oh, welcome back. We have a really good one for you today. I'm Dr. Jason Young.
I'm Dr. Kathy Lynch.
And this is the Pitch Podcast. Yeah,
Yeah,
pretty
here we
sure.
are.
I checked on the way in.
Yes.
There it is. Okay. Today we have a very special guest. This is Dr. Rick Green, MD, and plastic surgeon. So welcome.
Thanks. Great to be here.
Yeah, Rick, tell us about yourself. Like, where do you practice? We heard in the open that you've been practicing for 3 decades, which is longer than I've been alive. Yeah.
We actually are in Vancouver, Washington. So which is the original Vancouver, by the way.
Yes.
People don't know that, but
Oh, really?
George stopped there first
Oh.
Nice.
and then went up further north. So we are in the original Vancouver. I have a small private practice, plastic surgery, so I'm self-employed.
Okay.
And I have a partner who's wonderful. Been with her working together for the last 8 years. This practice was started in 2007 with a different partner who's now happily retired and traveling the world. But
warms my heart.
Yes, but life is good, and I actually am proud of the fact that our practice has done well, and we're still self-employed, which has been a lot of fun. And our practice actually does a large gamut of things. We're about half cosmetic, half reconstructive. So we'll do different things every day. And
We're going to talk about what that means because I don't know what that means.
You'll find out.
Yeah. Well, a really important question that we always like to ask doctors that come on here is, did you become an MD because you couldn't get into chiropractic school?
I didn't know what a chiropractor was. I might have considered it, but you don't know what you don't know.
This is true.
So I couldn't even ask the question.
Yeah.
Jason, you buried the lead.
I did.
Yeah, this is a fellow Golden Domer.
Oh, that's right.
So if we break out into like college football talk in the middle of the podcast,
or the fight
you're gonna have to
song
edit.
or whatever. Is there a fight song? Do you guys know the fight song?
It's the greatest of all college fight songs.
It is it? Okay.
Yes.
Yeah, and you might not know this looking at me, but I actually played for Notre Dame.
Did you really? What'd you play?
Clarinet. And I was in the marching band, and honestly, I got more field time than most of the players. And it was great. At that time, the stadium was kind of its original size, 60,000 people cheering for you as you're marching out. It was a lot of fun.
That's sweet.
So, yeah.
Those guys put in a lot of time. I would hear them all week long practicing for football games on Fridays.
In the shadow of touchdown
Saturdays.
Jesus.
In the shadow, yeah.
Yeah, we were 3 hours a day and then all day Saturday.
Yeah.
So, and it was totally worth it.
It's like a
super
full-time
fun.
job for these guys.
Yeah. Oh my goodness.
They weren't kidding. So I did not know that about you. That's pretty cool.
That is really impressive. You like this guy even better.
Yeah. Oh yeah. He got way more He got more field time than Rudy.
Yeah. Well,
that's an interesting little historical tidbit. I was in the stadium the day they filmed the last scene of Rudy, where Rudy gets in and then is carried on the shoulders of the players. They needed to film it in the stadium with a full stadium, and it just happened to be the game where I was in the stadium. So theoretically, I am in the Rudy movie.
So we can hear you chanting, Rudy, Rudy. Yeah. Oh my god!
Like, why are you putting that guy in?
Well, and I think this is good to talk about because you were actually referred to the show by a mutual friend, and the only reason that you agreed to do it was because you knew about Kathy's
absolutely
Notre Dame ties,
100%.
right?
Yeah.
Yes.
Yeah. And I do
Thanks,
appreciate your shirt, wearing the shirt for me.
Showing out today.
And it's double layered too.
Oh yeah,
like
I
you showed us
I got
when
the
you
Notre
came
Dame
in.
T-shirt.
Yeah, she's got a backup. You know,
Yeah.
just I don't know what would happen, but in case you lose the outer layer, she's got to back up Notre Dame underneath.
Yes, you must. I mean, if I end up in the hospital, you know, and they got to take layers off, they're like, wow, where'd she go to school?
Oh, she's going to be okay. She's going to be okay, right?
I don't know, Katie. I don't think it means as much out here in the Northwest as it does in the Midwest or the East.
It doesn't. There's not as much hate out here.
Not as much as we're used to.
Right, not as much. But the Pac-12 people do not love Notre Dame because...
Well, we already beat you guys real bad in the Fiesta Bowl, so...
That was like
1990. That's true.
I think that was 2000, actually.
Oh, was it?
Yeah. I think I can't remember.
Was it Y2K?
Yeah, something like that. There was probably a computer glitch. So, plastic surgery. Now, this, I was really excited to talk about this because is it fair to say that there is some stigma in the world about plastic surgery?
Well, yeah, and here's an interesting story relative to that. I grew up across the street from a surgeon, and he was my advisor in medical school.
Oh, wow.
And there were 3 of us actually from the same small town outside of Chicago. And he says, I want one of you guys to be a surgeon. And so after a year or so, I said, you know, I was talking to him one day. I said, I think I'd like to be a surgeon. He says, oh, well, what kind of surgeon do you want to be? I said, I don't know, but all I know is I don't want to be a plastic surgeon. And he said, why is that? I said, well, it's just foo-foo stuff. Hence the stigma that you're referring to.
Yeah.
He says, well, let me kind of show you what plastic surgeons really do. Now, he was a surgical oncologist. He did a lot of abdominal cancer surgery and things like that. But he had a book in his office of all these flaps that plastic surgeons would use to close up holes that other surgeons had created. And I thought, oh, well, this looks sort of interesting. And then right at the beginning of my 3rd year in medical school, when we first go into the hospitals, 2 things happened. I was randomly assigned to surgery first, and I was randomly assigned to 2 weeks of plastic surgery. The very first day, I walk into the plastic surgery clinic at Cook County Hospital in Chicago, and the resident there says, okay, there's this woman here who has a capsular contracture of her breast, and you're going to put your hands at 12 o'clock and 6 o'clock, and I'm going to put my hands at 9 o'clock and 3 o'clock, and we're both going to squeeze as hard as we can. And this is like I had just walked into the 3rd year.
Was she conscious?
She was absolutely conscious.
Oh, my goodness.
So we put our hands there, and we both squeezed literally as hard as we can, and the scar around the implant pops. That's called a closed capsulotomy, which is no longer allowed because it'll void the warranty of an implant. But if I'm telling the story to my friends, I will say, so I thought, this wouldn't be a bad way to make a living. But I don't tell that to patients. The second day, I walked into a craniofacial surgery, like a skull remodeling on an infant.
Wow, oh my gosh.
That was being done with the neurosurgeons, and it was a 13-hour operation, and that 13 hours went by like nothing. And I'm thinking, this is the coolest thing in the world.
You were hooked.
I cannot believe that people can do this. And then I thought, oh, wow, I'm enjoying this so much. I can't wait to find out what I really want to do.
Yeah.
And there was nothing even close to
Nothing
that.
compared.
Yeah, exactly.
Wow.
So that's amazing.
Great story.
Well, and it makes me think, whenever we were talking about you coming on, you were telling me a little bit about the history of plastic surgery. So, which made me think, oh, there hasn't just always been plastic surgery, child of the 80s. And so I'm thinking like Michael Jackson, he was probably the first.
Right.
No, but like, how did this discipline even get started?
Well, plastic surgery, interestingly, goes back a long, long time. It actually goes back about 3,000 years. And in ancient India, a punishment for misbehavior of whatever kind would be to have your nose cut off.
Oh.
And so there were Indian surgeons back then who would lift a piece of skin but off of the forearm, but leave it attached to the forearm, but then sew the other end of it to the nose, come back 3 weeks later, detach it, and you could reconstruct a nose that way. That same technique was used in the 1500s, 1600s in Italy. There was a Dr. Tagliacozzi, and it's called the Tagliacozzi flap, and a variant of that is still actually being used today. We actually we'll take skin from the forehead,
Mhm.
detach it, sort of rotate it down, and tie that to the end of the nose. Come back and get rid of it, not get rid of it, detach it 3 weeks later, and yes, you can recreate a nose that way. We're modern
I was
plastic
wondering
surgeons.
about ways that I could recreate a nose.
Yeah,
Like I can
yeah.
do that at
Now
home.
you know.
I can just do that at home.
What?
Is there a YouTube video that?
I'm sure there is, but I wouldn't
There is.
follow it.
Yeah.
You want to watch it?
No,
Take a forehead
actually,
flap.
I definitely don't.
You know, this is another
Come with
thing-
me as I reconstruct a nose from
Yeah.
a forearm. No.
You know, you're a social media person and digital person. I mean, every single operation that you could ever imagine is on YouTube,
Mm.
and that is how we learn. If we
Wow.
need to learn a new technique, which actually happened just earlier this year, we will go on YouTube.
Yeah.
And
Okay.
that's how we learn it. But getting back to the history of plastic surgery, modern plastic surgery.
Real quick though,
Yeah,
I think this is a great time for
Yeah.
the disclaimer.
Yeah.
This is entertainment only.
Oh.
Yes.
We're not giving medical advice or encouraging anybody to go out and do home plastic surgery.
No.
Okay.
No,
So
it takes
yes,
longer to
our
learn how
our
to-
insurance company has just sighed a huge breath of relief. Okay. So
Good.
back to the history.
Okay. And I'm in full agreement with that.
Figured you
Yeah.
would be. Yeah.
So the modern plastic surgery started in World War I, actually. And there was trench warfare, bombs being lobbed back and forth. And people would get these, soldiers would get these gruesome facial injuries. And there were no techniques described at the time as to how you would fix this.
Mm.
And so these soldiers were often left to just live out their lives in hiding, basically.
Like missing a jaw or an eye.
Exactly,
or something like that.
exactly, or nose.
Mm.
And there was a surgeon in England named Harold Gillies who was a ENT surgeon. There were also dentists at the time that were interested in this because a lot of the injuries were jaw injuries. But he single-handedly figured out techniques to fix these injuries, and so he was the very first modern plastic surgeon. No one was called a plastic surgeon at that time. By the way, patients ask me all the time, like, what kind of plastic do you use? I was waiting for you
Yeah.
to ask that
Right.
I was
question.
thinking that.
Well, I hear like you
yeah.
can just 3D print stuff now, right?
Yeah, so you have to use the right kind of plastic.
Yeah.
But where does it come from? It comes from the Greek word for molding or to mold, which is plastiki. I always thought it was plastikos, but I have a card-carrying Greek patient who was in the office 3 weeks ago, and I said, I have a question for you. I always wondered this. What is Greek for to mold? And she said plastiki. Is how she said it. So the bottom line is it's mold, malleable, that sort of, or to shape. Maybe it would be another term for it. But that's where the name comes from. But yeah, it was World War I. And if anyone's ever interested in it, there's a really cool book called The Facemaker that is about Harold Gillies. And not only was he a plastic surgeon, he was a champion amateur golfer in England.
Nice.
Of course he was.
Yes, perfect.
My hero.
I was gonna ask if he was a champion golfer, and he was.
You probably just assumed that he.
Yeah, he
but
probably
it's
yes.
Always good to make sure. But that's where it came from. That's where it all started.
That's funny
Wow.
because the PT profession also started after World War I.
Oh, I didn't know that.
Yeah, that's where it was born for the same reason.
Mhm.
You know, soldiers came back. Well, they came back first of all alive
Mhm.
because we had doctors on the scene,
Yes.
right? And they came back alive, but also disabled. And so when they first came back, they needed. I think they started as nurses to help rehab them. They were rehab specialists, I think.
Yeah.
Mm-hmm.
And so, yeah, that's when physical therapy started as well.
And chiropractic was about 20 years before both of those, and we probably caused World War I. Yeah,
Likely.
yeah. Depending upon who you talk to.
Yeah.
Yeah.
Likely.
Yeah. I will tell you honestly, Jason. Years ago, I read a book on the history of chiropractic just because I was
Wow.
curious,
It's interesting history.
like
and
that.
I think you've evolved.
Definitely
Fortunately.
have. Yeah. Some people don't want us to
Mhm.
because it's funner to have a cartoon caricature of what a chiropractor is, but
Yeah.
Mhm.
definitely evolved. Definitely
Yes.
evolved. So
You know, there was an interesting story in that book I mentioned, The Facemaker, where at this veterans hospital in England, huge hospital, there were benches that were painted blue.
mhm.
And the soldiers with the facial injuries were considered so unpleasant to look at by the average person, that they were instructed if you're outside, you have to sit on these blue benches, and then the general public that's walking by knew that the
Not
blue
to look.
benches you wouldn't look.
Right.
What?
And then
And
they would like maybe charge like $1 or something like that if you did want to look. Is that how they treated those guys? That's terrible.
It was really well. There's even worse than that. There was lots of stories of fiancés writing the Dear John letters,
Ah,
and
geez.
people losing their jobs or having to
Mm.
work kind of in hiding. So to be honest, again, for Harold Gillies and then his students to figure out how to fix all
Mm-hmm.
this, and there are before and after pictures in this book of these original
Oh,
patients,
wow.
and it
Wow.
is fascinating, and it's really, really, really good work.
Well, now, and plastic
Nice.
surgery though is not just about looks; it's also about
Um,
function, right? Because
100%.
if
Correct.
you
Mhm.
if you don't have a functioning eyelid
Mhm.
or jaw or
hmm
nose, there's other health issues that follow that, right?
100%. That's exactly right. Yeah. So, um, I, when I'm talking to my patients, I always say that, first, our job number one is to keep you safe. That's job
Mm-hmm.
number one. But number two is to restore normal. And so to make people look different or odd, you mentioned Michael Jackson
Mm-hmm.
earlier, who probably just took it a little bit too
Mhm.
far. But restoring normal is what we do every day, and I think that's a really great goal. If we're doing a breast reconstruction, for example, getting a woman to the point where she just doesn't ever think about it anymore,
Yeah.
or doesn't think
Mhm.
about the cancer,
Mhm.
that is that's actually very satisfying to be able to
Yeah.
do
Mhm.
something like that.
Well, and it's interesting because I've had women who have had breast cancer and they forget that they've had a mastectomy,
Mhm.
hmm
which I
Mhm.
think is like, wow,
It's
that's
huge.
that's good
hmm
work,
It's huge.
right?
It's
yeah.
Yeah.
it's part of a woman's identity.
hmm
Mm-hmm.
And they can grieve that loss if they don't have that part of their body.
Mm-hmm.
So yeah, I think well, it's one of the gifts that medicine has given us.
Yeah.
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 And I think it means different things to
Mhm.
different people. There's some
Mhm.
people that are like, yeah, I never liked him anyway.
Right.
And but you're absolutely right.
Mhm.
It's I think it comes down to stigma because
Mhm.
there's
hmm
stigma both ways, right? It's like,
Yeah.
oh, you've had plastic surgery or oh, you need plastic surgery. And so I imagine there's so many kind of layers to what you do from not just a technical standpoint, but also like psychologically and people's mental health.
hmm
I imagine the plastic surgery is really critical.
It is. People though still are judgy, and I'll have patients that say,
Mhm.
"Oh, I ran into somebody today who said I would never do something like that," or I had a patient who's asked me why I'm doing that. I just you don't need that,
Mhm.
and so so you're exactly right. But I think if we have that attitude that we're not trying to do anything other than just restore normal, restore confidence, get rid of that self-consciousness that people can have about differences.
Mhm.
Mhm.
But there are some people who are, like, pathological with it, right? I mean, we've seen some of the
Mhm.
examples of it's, like, people that, like, they don't look anything like they used to or anybody used to.
Mhm.
Um, so let me ask your opinion on that. I mean, the surgeons who do it, like, how would they justify, "Yeah, I'm gonna, help you keep going down this road," knowing that, like, they're getting farther and farther from normal? Are there people out there that are just like, "Hey, just as long as you pay me for a surgery," or how does that happen?
I think that's the only explanation,
Mm,
honestly, because I don't understand it. And I think there are surgeons, I'm sure, different parts of the country that if you're willing to pay X amount of dollars, they're willing to do,
Mhm.
whatever it is that you ask. We do spend time, I wouldn't say every day, but a couple times a month talking people out of
Yeah.
something
mm,
because they'll look at pictures on social media
Mm.
or in magazines that are just completely unrealistic or not related to their body or just it aren't for them. So I actually when people go overboard like that, I never think that that's the patient's fault. I always think it's the doctor's fault.
Mhm.
mm.
Like just because you can do something doesn't mean you should do something.
Oh,
Fantastic.
what a weird idea.
Mhm.
You
Yeah.
also have advanced training in hand surgery as
Mhm.
well, right?
Yeah, a lot of people don't know that in plastic surgery residency, 25% of our training is in surgery of the hand. And so we'll
Mm,
work with orthopedic surgeons and plastic surgeons together. And people say, well, what cosmetic surgery do you do on the hand? We don't do cosmetic surgery on the hand. Hand is more in your realm in the sense of, function, form and function. And we often don't care how the hand looks. We care, does it hurt and does it work?
Yeah.
Right.
And actually physical therapy / occupational therapy is a big part of the treatment for a hand. But in any case, I liked doing hand surgery. Why? Because when you do hand surgery, you sit down. And
That's nice.
it's very relaxing. Yeah, you sit.
It's very relaxing.
And when we do hand surgery, you have a tourniquet. So there's no bleeding when you do hand surgery.
Oh, really interesting.
So when we have medical students in, we work with Washington State Medical School. I'll give a shout out to them. We like our students there.
Cougars.
Yes.
Part of the pack too. Yes.
Exactly. And they're very proud of that.
Yes.
But in any case, that's a great way to teach students because no bleeding, very easy to look at anatomy. Actually, hand anatomy is really cool. So
super cool.
So yeah, there's a lot of things that I like about hand. Early in my career, when I first started, about 2/3 of what I did was surgery of the hand.
Like, are we talking like carpal tunnel, trigger finger, those kinds of
trigger
things?
finger, basal joint arthritis, so wrist arthritis, Dupuytren's in the Northwest is huge. Actually, that's in my family. I keep waiting to get it because my grandparents had it, my parents had it. But I just looked this morning and I still don't have it.
Good job.
Thanks. For those of you who don't know, it's a contracture of the hand where you can't straighten your fingers out. But then tendon injuries, tennis elbow, golfer's elbow, any other sports related elbows.
Do you want to know a weird fact? In the state of Oregon, chiropractors can do carpal tunnel surgery.
What?
Yes, because it's considered minor surgery and you're not opening a major body cavity. So all chiropractors have to pass a minor surgery test to get your license in Oregon. There's maybe like 5 people that do it because there's more stuff beyond that. So my advice to everybody listening is don't go to a chiropractor to get carpal tunnel surgery. We're not doing a lot of them. I could maybe recommend an orthopedic surgeon or a plastic surgeon.
How about that?
Yeah, but go to chiropractors for adjustments, not carpal tunnel surgery.
The hand's so important, and this is one of the things they taught us in PT school because really that's how we interact with the world a lot of times. And so if we don't have that function with their hand, when people don't have that function with their hand, it affects everything that they do on a daily basis, right? From handing somebody their credit card, using it now, typing, being able to swipe the credit card or
it's weird. I usually do that with my teeth. Oh, but I get it because how do I get the card in my teeth? Yeah, I got it. Okay, all right. Yeah, you're right. Yeah.
I have a lot of patients that will tell me, I use my hands every day. And
who does that?
Yeah. I said, well, I do too. We
got that in common. Yeah. It's just really important.
Yeah. You mean you're not using your teeth to do plastic surgery?
Not anymore.
Not since the board complaint. No.
But so you mentioned teeth. The chief of plastic surgery where I trained, Loyola University in Chicago, was a dentist originally, and most of the original plastic surgeons were dentists. And in our training, we had to learn how to take out teeth, like broken teeth, jaw fractures, and stuff. Yeah. So I will brag that at least in Clark County, Washington, I'm the only MD that knows how the teeth are numbered.
Oh, okay.
Okay.
Yeah. And it's top to bottom, here to here, here to here, 1 to 16, 17 to 32. So if you ever need to know which tooth, but it's you go to the dentist and he's like, oh yeah, he's talking to the dental assistant. It's like, let's see, 16. You're like, I know, okay, guys, I know which one. You don't need to use the code. I know, 16.
You should look at 14.
Yeah, it feels a lot more like 15 to me.
I do say that. I said I've gotten a little. Can you just check? Between 19 and 20, and they never. Oh, how do you know? They never say, how do you know? They just okay, yeah.
Well, you guys have had that experience too, right? When you have that patient that knows a little too much,
yes.
Right? Like I'll have somebody comes in, they're like, yeah, it feels like it's the L4, L5 disc, and it's like,
I always side-eye him.
What are you?
Mhm.
What are you?
That's what I do.
Yeah.
I'm
I've
like,
watched Dexter. That's
Yeah. Right. Or in your case, nip tuck, right? People come in, they're like, I
Oh
want
my
this procedure.
gosh.
And it's like,
Oh my gosh.
I never watched that, but it seems like a crazy show.
Yeah, not my style.
Yeah.
Mhm.
Yeah.
I didn't watch that.
You
I've
lived
also
it.
never watched
Yeah.
Dr. Pimple Popper. In case
Yeah,
anyone's
no.
ever, I just don't know why
Yeah.
people would find that interesting.
No,
No,
thanks.
not for me.
Mhm.
No, thanks.
Well,
Mhm.
tell us more about your training. Besides Notre Dame, we can.
Yeah.
skip past
Yeah, obviously. That's
Yes,
good.
that was
Yeah.
excellent.
So there's after college, there's four. I actually went straight to medical school
Mm.
from college. That's
Mm.
not as common these days,
Right.
but it was reasonably common back then. So I went to the University of Illinois Medical School right in the downtown Chicago,
Oh.
and
Fighting
it was
Illini.
Yeah.
Fighting Illini. But I have no loyalty to Illinois because the main Illinois campus where the football was played
Yeah.
was 200 miles away from Chicago. So that
Mm.
that really didn't affect us. But a great experience, a real melting pot of people and conditions, and I really loved my medical school experience. I had great friends that I still stay in touch with, and that was wonderful. And then I matched into the 5-year general surgery program at Loyola, and knowing that I wanted to be a plastic surgeon, but then you had to go to or finish a general surgery program and then apply to a plastic surgery residency after 5 years of general surgery. I was very fortunate at Loyola; they would occasionally take a resident into plastic surgery after 3 years of
Oh.
general surgery,
Nice.
and so that's what I was able to do.
Okay.
The the general surgery residency director was not happy about it, but I will just tell a little story about kind of my learning experience. Back then, there were no residency work restriction hours. So
Oh,
as an intern, I was
I've heard
working
about
about
that, yeah.
110 hours a week. It was
How
a
is that
lot.
possible?
Yeah, for
Yeah.
people who are trying to do the math, there's only 100 hours in the week.
There's 168, as it turns out.
How is that possible?
But it was really crazy. And so I was scrubbing one time, preparing to go into surgery with the program chair of our general surgery residency, who was a vascular surgeon. And he asked me a question about a carotid endarterectomy, cleaning out an artery in the neck.
Mhm.
And I said, I'm sorry, Dr. Baker, I don't know. Because I was just exhausted. I was
Right.
trying to survive. I don't know. He says, damn it, Green. If you think we're going to spoon feed you this stuff, you can take that spoon and shove it up your ass. And I'm thinking, wow, this is a really nurturing environment.
Yeah.
Nurturing learning environment.
Lovely.
Yeah. Yeah. And then, so the
Sure.
next year, I applied to this program to go into plastics. And fortunately, I had a mentor. I always feel like I was the luckiest person in the world because I had somebody that paid attention to me when I was young, a young first-year surgeon. And it was a guy named Juan Angelatz, a plastic surgeon, originally from Lima, Peru, but who had trained in Chicago. And at the time, the plastic surgery department was running the burn unit at Loyola. It was a busy burn unit. And I went into the operating room one day with him, and I said, Dr. Angelatz, I'm interested in plastic surgery. And for whatever reason, he took me under his wing and basically gave me my career.
Wow.
Oh,
And
cool.
so he was just great, and we had a lifelong relationship. He passed away just last year, but he was sort of like my second dad, really.
Yeah.
And
Wow.
that was wonderful. But I did ultimately 3 years of general surgery, 3 years of plastic surgery training, which was super fun. In plastic surgery, there's so much to learn, so much to do.
Yeah.
And one of my favorite parts of plastic surgery training was actually pediatric plastic surgery. And again, what do people do? And what cosmetic surgery are you doing on kids? We're not doing.
It's like
cosmetic surgery, but-
babies who want the Brazilian butt lift. Is that what it is?
Yeah.
Yeah.
It's a very quick operation though, and normally it's not. And they're just easier to flip over back and forth. Yeah. But no, like pediatric plastic surgery, so cleft lip, cleft palate, ear reconstruction. Sometimes people are born without an ear, and you
And
recreate
that stuff
that.
is so amazing. Like the technology is
It's
just
cool.
so far beyond. Like
Mhm.
I remember as a kid, like it was not hard to spot kids who had a cleft palate, and
Mhm.
like now,
You can't tell.
yeah, you hardly see children that like you would have to look really hard.
Mhm.
Yeah, the technology is amazing.
Mhm.
Yeah.
Well, with that, what you have to really look for is the nose. That's how you know if it's a really great cleft repair, because whenever there's a cleft lip, the nostril on the involved side will flatten.
Right.
Oh,
And so a
okay.
big part of cleft lip repair is actually cleft lip nose repair.
Yeah,
And so
okay.
that's interesting. Another thing that we would do would be, like I mentioned at the very beginning of this conversation with remodeling the skull, there's little lines in the skull, like the soft spot. When you hear the soft
Yeah.
spot, that's actually called a suture. And these sutures have cartilage, but not calcium when we're born, so we can get through the birth canal. And sometimes they fuse too soon. And if that's the case, the head can be misshapen. And so plastic surgeons will fix that. There's a lot of pediatric hand surgery to be done. There was a drug back in the 1960s that women were taking for morning sickness called
The
thalidomide.
Oh.
we talked
And
about
that
that.
created all sorts of abnormalities in the extremities, but especially the hands. And so there are many young children that were born without thumbs. And so there's a way to recreate a thumb using an index finger that you're rotating. And so just super clever stuff. So sometimes people ask me, like, what is your favorite operation to do? And I would say that my favorite operation to do is an operation I never get to do unless I go and do a medical mission trip, and that's a cleft lip repair. And the last one I did was actually on a 22-year-old woman in Peru who had an unrepaired cleft lip. And what I remember about her is that she would not smile. I wanted her to smile in the pre-picture because I wanted to see basically the extent of the cleft.
Yeah.
She wouldn't do it. But the next day, after her lip was repaired under local anesthesia, she smiled.
Wow.
And that was really cool.
That's really cool.
Oh man, that's awesome.
Yeah.
So you've done these medical missions.
Yeah, when again, my mentor, Dr. Angelots, every year he would invite the senior residents to go on a trip to Peru with him, and so I am now a member of the Peruvian American Medical Society.
All right.
Oh,
But
okay.
we went to different places, and this, you might appreciate this story. It was February of 1995, and it was winter in Chicago, and we went to this trip. On this trip, I met that woman that I just described. We were doing other cleft palates and other things like that on the trip. But after we finished, we actually went back to Peru, and I got to meet some of Dr. Angelot's family. And there was this beach club that they liked to go to. And of course, the seasons are reversed. It's South America. So February is summer there. We're sitting at the beach club, and we have our swimsuits on. And I noticed Dr. Angelot's brother-in-law is staring at me. And he's like staring and staring. And finally, I just said, "What? What are you looking at?" And he said, "You are so white."
I was thinking that same thing a few times. No, just
and I said, "Hey, it's February. I'm from Chicago." So, but it was lovely, and I've had the opportunity to go back there, a few more times, and I
awesome.
Super cool.
It's kind of like I don't know if either of you have had the experience of just medicine without attorneys, without consent forms, without bills.
Wish.
And the only payment is a hug or a smile or just watching a mom, look at her baby that you just had the privilege of helping.
Wow.
So,
Yeah,
that was really neat.
Wow.
That's amazing.
Oh my gosh, that's so cool.
So in preparing for this, I saw a statistic. I don't know if it's true because I got it from the internet. Wikipedia, our main source. But it said that plastic surgeries are up 40% since the pandemic. Is that true, and why?
It was very true. I tell you, I don't know about your business, but the pandemic was great for our business. A lot of it is Zoom.
Yeah.
Especially for the surgical things we
Zoom
do.
face, is that what they call it?
I haven't heard that term, but I completely understand that term. Usually it says it's like I should have gotten a ring light face is what it should be, because a lot of times it's the lighting that creates the problem. But people were all of a sudden had lots of time to look at themselves, and they were seeing themselves that like they never had before, and they weren't going anywhere.
Yeah.
So if they did have some discretionary income, they were doing things like laser or
might as well get some work
fillers
done.
or surgery or eyelids or whatever. And so it has it has gone up. And we get these little surveys. Do you feel the economy is affecting your business? And I've never really felt like the
Yeah.
economy, better or for worse, is affecting the business, because this is a priority for certain people. And if it's enough of a priority, they'll
Sure.
make it happen.
Yeah.
But yeah, I think there's no question. The other reason I think actually why procedures are up, and I basically mean surgical and non-surgical procedures are up, is because I think things have been destigmatized a little bit because it's now so commonplace. One thing I personally tend to be a little bit uncomfortable with still is posting a bunch of pictures of my patients on the internet, on the website.
Yeah.
But you get a young surgeon in there, everything goes
Yeah.
on the website.
Yeah.
We have
Well, and I was looking through your website, and you don't have a ton of
Mm-mm.
before and
No.
after.
No,
Yeah.
but I'm happy to show them in the office.
Sure.
Yeah.
Yeah.
Right.
Yeah.
But I
I
have
actually
always
thought that
found-
was kind of cool
Yeah.
because it's like I don't know, patients are patients.
Yeah.
They're not posters or advertisements, and
Yeah,
I think that's really
But
kind of neat.
for some reason in this day of posting your entire life
Yeah.
on the internet, people have this expectation that you're going to be able to see all of these pictures, and we have an associate now who does a good job of posting pictures, but she will literally ask every single patient, "Can I post your picture?" And obviously, we'll never post anything unless people
Sure.
give their
Yeah.
permission. But even with permission, I guess I'm just at the end part of my career where I'm just a little bit uncomfortable with that because we didn't in the past
Right.
share as much as we share
Oh,
now.
Yeah.
we
And
overshare.
so, yeah. But that being said, I have lots and lots of patients who have given permission to, oh, yeah, you want to show other patients my picture? Be happy to do that. And I think that is super helpful. We had a wonderful patient recently who was having a tummy tuck, after having kids and so forth. And she actually documented her whole experience. We didn't ask her to do it. She
Yeah.
just wanted to do it, and I think she wanted to serve as a kind of an education source for
Yeah.
people that were considering the same thing. So I think done right, I think there is a lot of value in that. But it just for whatever reason, and I just think it's the era in which I grew up, I'm just still a little bit uncomfortable with all that.
Yeah. Respect
Yeah.
that.
Are you starting to see, because of the GLPs trending, are you starting to see more like skin removal requests?
Yes, there's GLPs are really amazing, and I was very interested in listening to your show on peptides, by the way, because people will come in and ask about all these peptides.
Yeah.
I was just so,
It's like the
I
one
thought-
peptide we didn't talk
Yeah,
about.
I know.
Yeah, which is the most.
but the one
famous
peptide you
one out
should have
there.
talked
Yeah,
about.
right.
We will.
But-
we will.
But I'm thinking because people talk about peptides, and I think, well, everything's a peptide.
Mhm.
But that if you haven't seen that episode, I would recommend it because it was really well done and it's evidence based. How about that?
Yes,
Crazy.
yes. Win.
Who would have thought?
A win for the pitch.
But originally, bariatric surgery was the thing that really got a lot of people coming in because insurance would pay for the bariatric surgery. Insurance would not pay for the aftermath of the bariatric surgery. And what I noticed in some, but not all bariatric surgery patients, is that especially if they had a true gastric bypass, they would lose weight so rapidly that it would change the shape of their face.
Yeah.
Yeah.
And you could just tell by somebody walking in the door that they had this done. The
Like
GLP,
wearing like a skin suit.
Yeah.
Yeah,
What I've
exactly.
had patients describe it as. I
Yeah.
feel like I'm walking around in a parachute or something like that.
Yeah, and and they've done really good work to get to this point where they're at a healthy weight and feeling good, but then they're left with this reminder of what they've been through. And so again, getting back to the restoring normal idea, that we were seeing more and more and more of those patients. What I have found interesting, though, I actually just asked a medical student this the other day because they had done a 2-week rotation in bariatric surgery. I said, "Are they still busy? Are they still doing stuff?"
Yeah.
And she said, "Yep, their schedule's full, and there's just a lot of people that still that is the right choice for them." What I have noticed about the GLP-1s, and we've had them in our practice for about a year and a half now, but what I've noticed is that you tend to lose weight a little bit more slowly, you at least done properly, and you tend not to have that sort of melted appearance
Right.
that some people can have. So I keep waiting, and I don't know if you two feel the same way, but I keep waiting to what is the complication going to be?
Yeah.
What is the side effect going to be?
Something's
Because
gonna
other
happen.
than nausea or constipation, people just don't have problems with these things, and it really
Yeah.
works. And um, it's almost, you keep thinking it's too good to be true, but
That's what I keep thinking.
it's really good.
Yeah.
It's really good.
And
Seems too good to be true.
it's really interesting though, and we probably will do a full
Right.
episode on it, but I think that you look at where some of the backlash comes from, and a lot of times it's people who have something to sell,
Mm.
and
Hmm.
it's people who have something else to sell
Mhm.
other
Mhm.
than like a GLP. And so, and then there's always a subset of people that are just very vulnerable to um, inaccurate information, conspiracy theories, just because they have a low level of trust for establishment. And so they see that and they see that it's working, and then they automatically just don't want to trust it. But there's some of these things too where it's like some things are too good to be true and some things are just good,
Yeah.
right? And
It's
I
Yeah.
hard
think
for
that
us to believe.
I think this is just a good thing,
I
probably.
hope.
Well, what is your response when somebody comes to you and the statement is, "I've done my research and."
Yeah.
And we hear this all the time,
Yeah.
and typically that means they've been on TikTok
Yep.
Mhm.
and they've seen somebody, an influencer of some
Yeah.
kind, talk about something.
Mhm.
I just think it's hard. I'm sure you have patients. I think it's hard for people to know what is accurate information and what is
Mhm.
not.
Because you don't know what
Um,
you don't know.
Correct.
Yes.
Yeah, I had this experience very early on when I was actually just finishing chiropractic school, and I was talking with my mom about something. I can't even remember what the topic was, but I was like, "Yeah, mom, that's not a real thing. Like, I don't even remember what it was." And so she was like, "It is. There's a lot of research on it." And I was like, I've read it, and that's not a real thing." And so I was
Mhm.
like, "Well, show me what you've got." And so my mom believed, this is earlier on, she believed in printing out the internet. Like,
Mhm. Yeah.
there was what was on the internet, but when you printed it, it
It was
became
real.
real, right?
Mhm.
And so she came and she had just pages and pages of stuff that was printed out from like messaging boards and stuff. And
Mm.
she's like, "Look, here's the data, here's the research." And I was like, "Oh, wow. How do I explain this to somebody that I really care about that
Mhm.
this isn't data or research?" And so that's it is a real challenge,
It is a
especially with
challenge.
patients.
Mhm.
So,
Yeah,
mm,
exactly. Well, one thing I think that has evolved over my career is, it used to be that if you came into the plastic surgery office, you were pretty likely to be interested in surgery
Yeah.
of some
yeah,
Yeah.
kind.
yeah, yeah,
Yeah.
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 And so there were times where we had really short conversations
Mm.
because either there was a procedure we didn't offer, or they just weren't a candidate for surgery
Mm.
for
Hmm.
whatever reason. And that has completely flipped on its head, to where, throughout the day, probably three-fourths of what we do is non-surgical, and it
Wow.
might be
Really?
it might be injectables like
Oh,
Botox or
right.
fillers. It might be
Okay.
Okay.
we do a lot of laser
Hmm.
Mm.
in our office. In the year 2000, I became interested in, way back when. Remember that? Way
Y2K.
back when.
Yes.
I became interested in just the concept of laser,
Yeah.
Mhm.
and I was with a multi-specialty group at that time that had general surgeons and vascular surgeons, and I thought, well, people have spider veins and people have, interest in hair removal. Let's see if we can find a laser to do that. And we,
Hmm.
we got our first laser in 2002, and we've had various lasers in our practice ever since then. And there's a lot we can do with that.
Yeah.
And so we've, I would never have imagined in the middle of my surgery residency that I'd be talking, about skincare, or
Yeah.
talking about, laser or
Mhm.
these
Hmm.
injectables, because I just couldn't even imagine it. But
Right.
so there is a lot. One thing I like about being a plastic surgeon, though, is we never really have to talk anybody into anything,
Mhm.
Hmm.
because we effectively have all the tools.
Yeah.
Yeah.
And so if you want something non-surgical, great, we
Cool.
can
We'll
do
do
that.
something else.
You want surgery? Great, we can do that. And both are fun. Both,
Yeah.
I really enjoy talking to people. I enjoy my clinic days. We
So
enjoy our time in the
the
operating
most common sound in the clinic is "wee."
Yeah. We can
room.
do that.
Yeah. Well, so that conversation with patients, it kind of leads me. I was talking to a patient today, and she was appreciating the Pitch podcast. I think she's also a patient of yours,
Okay.
and she saw your picture on
Oh,
the
okay.
board, and she's like, "Why do you have a picture of my physical therapist?"
She's so cute.
Yeah. That's
That's why.
exactly what she said. Were you there? So we got talking about the podcast, and I was like, actually, today we're having on a plastic surgeon. I said, so is there a question that you would want me to ask a plastic surgeon? And so she said that she had a double mastectomy, and she described it as being a really important and good experience for her. She really appreciated her doctors, but she said she wanted me to ask you what advice you would give a patient in terms of like what they should do to advocate for themselves, especially if they're in the presence of a doctor who is just very confident about what they're doing to the point where it maybe feels a little overbearing and it's like they don't have choices and things like that. What kind of advice would you give a patient about advocating for themselves in that realm of plastic surgery?
I think this is a hugely important question to ask because this is something that almost everybody struggles with when they're going through very scary experiences like this. And first of all, what I would say is that there's no one way to do anything.
Hmm.
Secondly, I would say that in the breast cancer world, especially, it's really intimidating. And I will always tell breast cancer patients it's a journey. It's not like getting your appendix out. And there's going to be a bunch of doctors that are going to be talking at you with statistics, and you will not understand them. Frankly, I don't understand them because I'm not an oncologist, but
Mhm.
it's very intimidating and it's hard to know. But it can be with that, not having that knowledge, it can be difficult to advocate for yourself. But sometimes you'll, as a patient, connect with a particular doctor, and sometimes you won't. And there is nothing wrong with getting a second opinion.
Mm.
There's also nothing wrong with talking to friends or other people that have gone through this and say, who did you see? What was your experience like? Interestingly, funny that you mentioned that, but just this week, my lovely first cousin just underwent a double mastectomy.
Mm.
And she had the advantage, I think she realizes now, hopefully she realizes, of having a cousin who's a plastic surgeon. I
Yeah.
said, oh, wait a minute. I know who you should see.
Yeah.
Oh,
And
nice.
and so I just texted two surgeons that I really respect. One is a general surgeon who specializes in breast cancer, and another is a reconstructive surgeon that does the particular kind of reconstruction that my cousin might be interested in. And I was able to say, "Hey, would you mind? Would you be able to see my cousin?"
Mhm.
And they, "Oh yeah, 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 of course." But not everyone can do that.
No.
So
Yeah.
how do we do that? I think talking with your primary care doctor is not a bad idea because they will often know who patients like and who patients have had a good experience with.
Mhm.
But we have to advocate for ourselves, and it's true in every part of medicine. Somebody's had back pain for a long time, and their insurance carrier won't allow them to see this person or that person. Well, you got to rattle the cage and make a
Yeah.
fuss, but don't ever feel like as a patient like you are insulting a doctor by saying, I think I'm going to go get a second opinion. I think
Mhm.
any doctor that says that bristles at that, they're not somebody who you should see.
Yeah.
And in fact,
That is your second
That
opinion.
is your
yeah, yeah.
Yeah.
there you
And
have it.
I encourage people, hey, go talk to somebody else. And if they're saying the same thing I'm saying, then that's great. And if you're more comfortable with them, absolutely, go with them. But we want you to feel comfortable. And
Yeah.
we're not trying to make a sale. We're trying to educate people. And
Sure.
but I think people, it's very difficult to advocate for yourself because you, at least traditionally, you look at the doctor as being some sort of infallible authority.
Yeah.
But again, there's lots of paths to get to every destination.
Well, I think one thing that it kind of fits in with this, and it's just is really sad to see. I've had two patients who have said this, but they had like a single mastectomy, and then down the road, and I don't really ask about those things because it's like I don't know that everybody wants to talk with their chiropractor about
Mhm.
that. But down the road, what they found out was that they had the option of getting a reconstruction. And the thing, like, of course they had the option, but I think that there are some people that think that you only have that option if you're rich. right? Or you have really good insurance coverage and things like that, which really kind of made me sad because both of them kind of expressed that they didn't feel like they were as good as other people, and it was really kind of a badge of this is my poverty is I can't afford to get I can't afford to get a reconstruction. So,
You want to know something interesting about
what's
that?
that?
Clinton administration, 1998, federal
Hmm.
law requiring insurance companies to cover reconstruction
Wow.
of lumpectomy or
Mhm.
mastectomy, and are required to cover procedure on the opposite breast for purposes of symmetry. It's a
Awesome.
Wow.
federal law. And so a
Yes.
lot of people don't know that, and they think, well, I can't
Mm.
afford that, or that's cosmetic, so my
Yeah.
insurance would never
Hmm.
cover it. No. If somebody has a diagnosis of breast cancer, then they are, by federal law still, their insurance is required to cover that, including government insurance, Medicare, Medicaid, required to cover that.
Yes. If you are listening and that is
Yes.
you,
Yeah.
and you think that you
Mhm.
cannot afford it,
Your
you heard it on the
insurance.
Pitch Podcast, the ultimate
Yeah.
source of truth,
And
on the internet at
you know
least.
what's really helpful too is that if patients have the opportunity to, while they're, before they even have their surgery, ask for an appointment with a plastic surgeon. Doesn't necessarily mean you're going to have plastic surgery, uh, but it at least you have the opportunity to make an informed decision.
Yes.
Mhm.
The other thing that's relatively new, it's been around for a few years now, but there's a term called oncoplastic surgery.
Mm.
And oncoplastic
Mm.
surgery is using plastic surgery techniques, often at the same time as a lumpectomy
Mm.
or mastectomy, to do uh, to to take care of a deformity preemptively that
Hmm.
could be caused by the breast cancer surgery. And so that's something we do quite frequently, and it's actually fun. We get to work with the
Hmm.
breast surgeons,
Oh,
and
cool.
we might do, bilateral breast reduction, for example, and somebody that could benefit from that. But where the lumpectomy was, we'll take a little flapper breast tissue and kind of plug the hole, and so people come out basically with just having had a breast reduction, which they benefit from as
Yeah.
Mhm.
chiropractor and PT. You know that.
Yes.
Hopefully, you know that. Hopefully, you
Yes.
admit it.
It's like, is,
100%.
is that still like the most common elective surgery is a breast reduction?
It is, and if you ask every single plastic surgeon who are their happiest patients, breast reduction patients,
Absolutely.
Yep.
100% of the time.
That's been
But
my
insurance
experience.
doesn't always cover that.
No,
Oh, there's so many hoops that we have
that
to
is
jump
the
through.
that is the hardest thing for our staff, our wonderful staff,
Yeah.
to
Shout out to the wonderful
yeah,
staff.
it's Salmon Creek
Yes.
Plastic Surgery. Thank you for your help
Yes.
in getting insurance authorization for breast reduction,
Yeah.
because it's just so easy to deny.
Yeah.
Right.
And there was a time few years ago where there was a certain insurance company in the greater Portland area. I won't mention any names because I don't want Regions Blue Cross to be embarrassed. But
Yes. If it were them.
if it were them,
Yes, which it is.
or if they knew
Or
who it
isn't.
was.
Yeah.
But the problem is they would deny every single authorization we sent in,
Wow.
every single one for a period of about a year and a half. And
See,
what
it doesn't just happen to
It's
us.
not just
No.
You know,
us.
woo.
and so what happened was we'd have to go through the process of appeal and
Yeah.
this sort of thing, which we do for our
Yeah.
patients, and which
Yeah.
you do because
Such a
we're
pain,
patient
but
advocates.
yeah.
Yeah.
But what patients often, here's another piece of information: how do insurance companies make money? Do they make money from your premium dollars? No,
No.
they make money from investing your premium dollars.
Mhm.
So that when the
Mhm.
stock market is good, the denials seem to become more frequent,
Yep.
because the longer they can hold on to the dollar, the more successful they are. And I'm not criticizing, other than this one instance with Blue Cross, but
You're not criticizing insurance companies? Like you
oh,
wouldn't
never.
criticize another insurance companies that's owned by what, Berkshire Hathaway? And their little lizard is investing all the money,
Mhm.
and so they're delaying payments and stuff. You
Huh.
wouldn't do that?
I wouldn't
I
know.
would. But
No,
okay.
Well,
Yeah.
it's your podcast.
Yeah.
Yeah. I don't know. It's frustrating, and it's frustrating for
Mhm.
patients, and they don't understand. They say, "I have good insurance. I don't understand what the problem is." But it's difficult, and just know that whatever medical office or surgical office or chiropractor, PT, everyone's advocating for it. But it's just difficult.
It
Yeah.
really
It's
is.
difficult, and I'd like to. There was something recently in the news about there was an insurance company I think it was United Healthcare actually, that they were going to get rid of pre-authorization
Yes.
for 30% of
Yes.
medical
That
CPT
just happened
costs.
this week, I think.
Right.
Yeah.
That doesn't mean that they get rid of not paying you, though.
Yeah.
Exactly.
And so, patients can still get stuck with bills if insurance companies after the fact do that. So that's a whole nother podcast.
Right.
Yeah,
idea,
we'll have
by
to
the
have you
way.
back for that one.
Yeah. We can rant. We can
Yes.
rant together.
Can we go back to the breast reconstruction when you're talking about your cousin? If a patient doesn't want an implant, what one do you recommend? Like, which one would you have recommended for your cousin in that sense?
Well, my cousin did her research.
Yeah. Real research
and
or
I don't
TikTok?
Is she on the
think
message
TikTok.
boards?
No. She's just super smart. And so she knew some questions to ask. And what she was interested in is what's called autologous reconstruction, where you take tissue from one part of the body, disconnect it from its blood supply, transfer it to another part of the body, reconnect it to its blood supply. And so you're using the patient's own tissue to reconstruct a breast. Now, that's not a procedure I offer. So that's exactly where, with her, I was kind of inferring that she was interested in that type of procedure. And I happen to know a surgeon in Portland who I think is the best at that procedure. And so texted her and said, would you be willing to see my cousin for that? Again, insurance will cover these procedures. And if it's appropriate for the patient, insurance will cover that. So again, there's lots of different things that can be done. Another thing that we've done a lot lately for people that aren't interested in implants is fat transfer.
Yeah.
You can take fat from one part of the body.
I'm happy to be a donor. It's like, is that a service I could provide? Like, I give blood.
You can, but you would be rejected. Yes, you'd be rejected, and it's not just because of your occupation. It's living tissue. So if you have an identical twin, it would work.
Ah, okay, yes.
genetically identical twin, no problemo. But otherwise, it has to be your own fatty tissue.
Body would reject it, right?
So, for example, this comes up sometimes where somebody's had lumpectomy and radiation. And radiation, I don't know if you've seen radiated tissues. I'm sure you have, but it creates scarring, stiffness, contraction,
and under the skin, even.
Yes, yes, within the tissues of whatever you're dealing with. But you can take fat. You can inject fat into radiated tissues and make them soft again, because it'll stimulate new blood vessel growth, and so it's a way of counteracting the effects of radiation, and then filling in divots or defects from that. So that's something we do a lot. But getting back to the operation that my cousin was potentially thinking about, that has not been around forever, but it has gotten really good. The people that do that operation are really, really good, and there are some centers in the country that are excellent at that. And New Orleans, for example, has a group of 9 plastic surgeons, and that's all they do.
Wow.
Is autologous breast reconstruction. And
what tissue are they taking?
You can take the lower abdominal tissue to use for a tummy, or get rid of for a tummy tuck.
Okay.
You can take the upper part of the gluteal area.
Oh, so you're taking muscle?
Not always. Well, yes and no. You're not taking functional muscle, but often the muscle is where the blood supply is going through. So you might take a piece of muscle.
Okay.
You can also take tissue from the back. We'll use latissimus and the skin over latissimus to reconstruct breast. And so those you can take thigh, actually, is another place where they can go for that. So a lot of it just depends on sort of the quality of tissues in different areas and how much volume somebody needs.
Right.
And but you can create, using their own tissue, autologous tissue, really natural looking breasts. That being said, one thing I tell my patients at always is a reconstructed breast is a reconstructed breast. It's not exactly the same as the original breast, but you've had a win where people are, step out of the shower, they're towing off, and they just don't notice anything weird in the mirror anymore.
Yeah,
that's huge.
And that's a win.
That's huge.
And these breast reconstructions can do that.
That's outstanding.
Yeah.
Do you send your patients to PT after they've had the lats moved?
We do, because they sort of have to learn to use their body again.
Yeah.
We actually would really enough would send. We haven't done this recently, but in the past we've sent people to PT after abdominoplasties.
Oh
'Cause
yeah,
every
right.
once in a while, somebody gets almost like a you know, the muscle's too relaxed. It just doesn't. It just doesn't seem to contract in the proper way. As it's flaccid. I didn't want to say the word flaccid. I don't like that word, but
Except that that's the
what-
word for it.
I
That's
know.
what it
That's the word
is.
for it.
Sorry,
Yeah.
flaccidity.
Yeah.
Just like a depressing word.
It really is.
It really is.
It
Yeah.
is.
Yeah. But anyhow, and I do think I send people to chiropractic too, because we'll have patients. It's actually more in the hand surgery world
Mhm.
where I have patients with chronic pain.
Mhm.
I even like acupuncture.
Yes.
And if somebody knows what the heck they're doing, it is one of those things. How does it work? Why does it work?
I
Don't
know.
Don't
I
know.
don't
But it
care.
works.
No,
Yeah.
it's magic. It's
Yeah.
magical. Yeah.
Mhm.
Yeah.
Yeah.
So no, we like having relationships
Yeah.
with people in the community like that.
Yes.
Outstanding.
We appreciate those surgeons too.
Well, you talked
Mhm.
about a win, and you've listened to the podcast enough to know that we play a game every single time.
Sometimes they just skip to the game.
Yeah, exactly.
Makes the podcast better.
Right.
It's true. It's
I
true.
know this.
If we're being real.
Basically, if this is your first time listening to the Pitch podcast, we torture you for about 45 minutes so that we can play a game.
Mhm.
Definitely not today. This has been so
Oh my gosh, it's
interesting.
been so great.
Yeah. I think that we should come back for part 2.
Mm-hmm. Yes.
But I think that this is a really, really good time to do a Pitch podcast Mad Libs.
Yes.
Okay.
Where it gets
So you've done Mad Libs before,
Yes.
I'm guessing. Okay. Are you good at them? There's no particular skill.
No.
Yeah.
I-
So
words.
I hope you are.
I'm not bad at them.
Okay. You know your parts of speech, like adjectives, nouns,
He probably had to
verbs.
take Latin. Did you have to take Latin in high school?
You learn in medical school. You learn Latin, Greek by default.
Mhm.
You know that the lumbrical muscle in the
Yes.
hand is a lumbrical muscle because that's Greek or Latin for worm.
Mhm.
Yes.
It looks like a worm. So there you go. It's not
Okay.
a part of speech, but I'll use worm at some point in this game.
Well, okay. Well, perfect. The first kind of word I'm going to need is an adjective. That's a description word.
Flaccid.
Flaccid.
Yes.
Okay. Oh, hang on a second. I got to restart this. Let's see. All right, there we go. And give me. Oh, I'm gonna have to write this somewhere else. Okay, I got this. Sorry, on the fly. My little program that I wrote to do this. All right. Give me an animal.
Echidna.
You're not gonna do a worm. What is echidna?
How do you spell that?
Echidna. ECHIDNA. It's it looks like a hedgehog.
Oh.
A big
Okay.
hedgehog.
Okay.
Super cute. And we met
All
one in Australia recently.
Raoul's nodding because he knows what that is.
Okay.
Mhm.
All right.
Okay.
All right. How about this? A body part.
The the little finger.
Little finger. All right. How about a noun?
Comb.
Hmm.
Comb. Okay. Give me the name of a medical business.
Medical business. Salmon Creek Plastic Surgery.
Oh, okay.
Yes. Okay. Like it.
All right. Another adjective, please.
Happy.
Happy. And a noun?
Did we already say worm?
Not
Is
yet.
that worm?
Okay. Another body part?
Let's do the left nostril.
Okay. And a number
13.
and a plural noun.
Eyelashes.
Okay. And we're going to need a celebrity.
Jason Young.
Oh, geez. A minor celebrity. Okay. And a number. How many words are there?
44.
I thought I told it 10. Okay. Another plural noun.
Footballs.
Okay.
Hmm.
And let's see. We're almost there. A noun.
Measuring cup.
Okay. This is going to be a good one.
Mhm.
And we're at an adjective and then a verb ending in ing.
Okay. silly, and thundering.
Thundering. And the final one is a noun.
Dog.
Dog. Got it. All right. This is an advertisement for a plastic surgery practice. Okay, here we go. Are you tired of looking like a flaccid echidna? Do you wish your little finger looked more like a comb? Come to Salmon Creek Plastic Surgery, where Dr. Rick Green, a board-certified surgeon and happy worm, will transform your left nostril in just 13 eyelashes.
Yes.
Our most requested procedure, the Jason Young package, where Rick uses 44 footballs and a single measuring cup to sculpt your dream silhouette. After surgery, relax in our silly recovery suite while our staff thundering you back. While our staff is thundering you back to confidence. Salmon Creek Plastic Surgery, because beauty is just a dog away. All right.
It doesn't get any better than
Nice.
that.
No, we'll use that. Can I use that?
I'm
Please.
gonna send that to you.
Thank you.
Yes. And we're also gonna send you a Pitch Podcast shirt because
Nice.
winning tradition. You know, you won the game,
Yes.
so we're gonna get you a shirt. We have several to choose from. I kind of think you should get the Nard shirt, although you can't really wear it because you are a real doctor.
Yeah.
So no.
But some people don't. They think that plastic surgeons aren't real doctors. So I think we have that in common.
Yeah.
Okay.
Sweet.
Yeah.
Okay.
Great.
So
We could
I'll
all start a
take it.
group practice. Excellent.
Yeah.
Sold.
Yeah.
Yeah. Well, thank you so much.
Yes.
Now we're going to do takeaways. Kathy,
Yeah.
you want to start us out?
I don't even know where to start with this. I'm going to let you start
Okay.
because I should have thought about this.
I think one of the biggest, I never want to have a patient tell me that they didn't think that they could get a
Yep.
reconstruction again. That was
Yes.
very
That
valuable
is
knowledge.
huge.
And I'm going to be telling women confidently, you are entitled to that under the law. So, because that's life changing. I think that what you do is really life changing,
really is.
and really appreciate you
thanks.
being here. So,
Yeah,
Kathy?
this hopefully this helps lift the stigma because like Jason said, I think what you do is life changing. It's yes, some of it obviously is cosmetic, but
which also isn't bad.
no stigma to that, but restoring function and restoring people's identity is huge, and so yeah, thanks for the gifts that you give people.
Yeah. Thanks.
And Rick, your turn. Takeaways. What'd you learn from Kathy today?
That it's okay to wear a Notre Dame shirt in public. I didn't know that.
People usually think this is North Dakota.
Yeah.
Not gonna lie.
You did your research. Huh?
That's right. Now, I think, takeaways for me that sometimes people ask me, am I too old to do this? And the oldest patient I operated on was 101. He had a big skin cancer on his nose, and I did took that out and did a little flap to kind of fix the nasal tip. But afterwards, I went out to talk to his kids, and the
80-year-old kids.
80-year-old kids. They were 80.
Wow.
And I said, your dad did great. Just have him take it easy over the weekend, and I'll see him next week, and we can get his stitches out. Well, did you tell him to take it easy? I said, no. Why? Well, he has a new chainsaw, and he's planning on going on cutting a bunch of brush this weekend.
Yeah.
Oh my god.
I said, well, don't let him cut brush this weekend.
Oh my gosh.
So
what kind of warranty do you offer on a repair on a 101-year-old?
not extended. Not extended. But
Especially one with a chainsaw.
This is going to last longer than your roof, sir.
I love patients like that. I sometimes the older the patient, just the more stories they have, the more fun it is. And
absolutely.
just, one thing the three of us do have in common is that we have plenty of time to talk to patients and get to know them.
Yes.
And everyone has a story. And sometimes what you anticipate will happen it's just the opposite.
Mhm.
And people are wonderful. So we're very lucky to do what we do, I think.
Fantastic.
Oh, and sorry, I got one more. Rick had more field time than Rudy.
Yes, very important.
Got it.
Suck it, Rudy.
Yeah.
All right.
That's
And
cool.
I guess there's one more thing.
That's right.
And that's there's no I in pitch.
Yeah.